or maybe some of them.
It's going live now.
Yes, it's fine. And there are people attendees in already.
So we have let them in. Not yet.
It seems like they've come in already.
I thought it's up to us to let them in.
Didn't do anything. I didn't do anything. But
Oh,
yes.
okay. Doesn't look very good, but okay. Anyway, whatever it is, let them in. Let the attendees in. Hi, Dr. Usley, are you ready to kick off?
Yes, thanks, Mr. Ramesh. I'm ready, I guess.
Okay, nice to meet virtually. I'll just do a quick introduction, pass it on to Chioma, and
Sure.
then he will introduce you. Is that okay?
Yeah, that's fine. Thanks.
All right. Carol, do we have everybody in? Yeah. Okay. All right. Good afternoon, ladies and gentlemen. Those of you who have joined us now, and I'm sure there are a lot more who registered who will be joining us soon. Thank you all for attending our webinar from the MABC and KPJ on long COVID syndrome. Dr. Yasli will be informing you of all the do's and don'ts for the long COVID syndrome. And I've just read this morning that long COVID cases are now starting to come in and fill up the hospital. So I think this is something we definitely need to look at. So without any further ado, can I kindly hand over to the KPJ Operations Manager, Chioma Zakir Bawari, who will give you a little bit for talk about KPJ. Chioma, all yours.
Okay, good afternoon, everybody. Thank you, Mr. Chairman, Mr. Ramesh Menon, Executive Director of Malaysia Australian Business Council, MABC, for bringing us today together. Okay, I am Omar, and Operation Manager for KPJ Ampang Puteri Specialist Hospital, a flagship hospital for KPJ Healthcare Berhad. Okay, by now I believe that everybody knows that healthcare has become a national issue, and pandemics are by nature cross-border events. So this session is very welcome, and we are glad to have here Dr. Muhammad Yazli Yuhana, infection control specialist, who is responsible to handle COVID cases on daily basis. So in fact, Dr. Yazli is the person one of the doctor at Hospital Sungai Buloh, and I believe he has vast experience handling the COVID cases for the last 2 years. The pandemic also has demonstrated the vital importance solidarity to confront global health threats. However, despite our multilateral efforts, inequities persist. Some require urgent action, others need structural changes. At the same time, it is important to remember that vaccine alone will not end the pandemic. We must continue to use every tool to suppress transmission, save lives, and end the pandemic. The longer the pandemic drags on, the longer the social and economic turmoil will continue, and the higher the chances that a new, more dangerous variant would emerge. Even as we work to end this pandemic, we must learn the lesson it is teaching us and prepare for the next one. We must ensure our health system also become more resilient so that we can continue to provide essential health services even in the time of crisis. I hope with this session we could come together for a better future. And I believe Dr. Yazli will be giving his ideas, sharing his experience based on many cases he attended. Hopefully we can learn from him and everybody will benefit from that. Thank you. Over to you.
Thank you, Encik Umar. And we now would like to introduce Dr. Yazli, who is the expert on long COVID, who will take us through the journey as to what we need to do in order to fight this continuing endemic as opposed to a pandemic. Dr. Yazli, all yours.
Sorry, I will introduce first the Dr. Yazli biography. Yeah. Yes. Thank you so much, Dr. Yazli. Thank you so much, Mr. Ramesh, Mr. Omar, for our collaborations. Yeah, to make this happen. So our distinguished panelist is Dr. Muhammad Yazli Yuhana, met from MABC from Ireland, Sessional Internal Medicines and also infectious disease. So Dr. Yazli received his undergraduate training from the Royal College of Surgeons in Ireland, RCSI, in 2005. He subsequently underwent his internship in Beaumont Hospital, one of the largest tertiary hospital in Dublin, Ireland, under the supervision of Professor Dr. Samuel McConkey, a consultant in general medicine and infectious disease. Following his internship, Dr. Yazli returned to Malaysia as a resident in internal medicine in University Malaya Medical Center, UMMC, where in his final year, he was appointed as a registrar in infectious disease and had completed his thesis in HIV and metabolic disorders under the supervision of Professor Dr. Adiba Kamaluzamans and Professor Dr. Rokia Pintek. Subsequently, Dr. Yazli joined the medical department in UITM and later became a fellow in infectious disease in Sungai Buloh Hospital and Kuala Lumpur General Hospitals, under the supervision of Dr. Christopher Lee, Dr. Suresh Kumar, and Dr. Leong Chi Loon. His deep interest in tropical medicine has brought him to Bangkok, Thailand, where under the supervision of Professor Dr. Sasitorn, Professor Dr. Daniel Paris, and Professor Dr. Scott Brexer, he has completed his doctoral his doctorate PhD in clinical tropical medicines from Mahidol University, Thailand. His doctorate research was in etiologies of fever amongst the Malaysian community in Teluk Intan, Perak, focusing in recurrential infectious. He returned to Malaysia in 2017 when he set up the infectious disease unit in UiTM. He has secured multiple national and international research grants and has given presentations in scientific conferences, both nationally and internationally. Dr. Yasli is a frequent speaker for the National Master Intensive Course programs. He lives in Kuala Lumpur currently and is interested in music and outdoor sports. That's so interesting. So yeah, now he's on mission with us in KPJ Amang Putri Specialist Hospital. So please welcome Dr. Muhammad Yasli Yuhana. Thank you, Doctor. Please.
Thank you.
Yeah.
Thank you for the introduction. Thank you, Mr. Ramesh, on behalf of the Malaysian Australian Chamber. Thank you, Choma, for the introduction. Thank you again for the introduction from KPJ. I'm not an expert in the long COVID syndrome. Okay, most of us in infectious diseases in Malaysia are kind of expert in the short COVID syndrome, but pretty much the long COVID syndrome is something that we have not really looked into. It's quite an important topic. It's a very important aspect of COVID because it's not life-threatening. Okay, unlike the short COVID syndrome where you need oxygen, when you need special medicine, when you need intensive care monitoring, where you die during that phase. But in the long COVID syndrome, it's annoying. It's annoying, but it's not life-threatening. So that's why it's not really looked into. But as we go into the discussion, we shall learn a little bit more about what is meant by long COVID syndrome. Now, I will share my slide. Okay, so everybody can see the slide, yeah?
No, doctor, we can't see your slide.
Okay, so today's talk is a long COVID syndrome. You can call me Yasli. Again, everybody knows about what happened in COVID. Okay, so once you get COVID infection, as opposed to the long COVID syndrome, I would say this is our short COVID syndrome.
Doctor, we can't see your slide, doctor.
Cannot, yeah? Cannot? Can?
Maybe you can share it again.
Not yet.
Right.
Maybe Nasmi can share from your end the slide.
No, just now doctor already shared, but I think been cancelled. So doctor have to share it again.
Okay. Ada?
Yes, now we can see
You
it.
can see now.
Okay, so we have seen COVID for 2 years. Okay, so December 2019, where Wuhan announced there's a new respiratory tract virus that cause rapid death among their population. So until today, next month will be 48 months of COVID lah. So when we first had COVID patient from Johor Bahru that transferred to Sungai Buloh, okay, in February 2020, everybody got panic. So everyone was panicked because nobody knows what to do. Okay, luckily the first wave, okay, the Wuhan family from Johor Bahru and small cluster of family from Johor, nobody died. Okay, they're all well. Okay, but during that time we throw in everything under the sun lah, the hydroxychloroquine, the Calitra that I'm sure everybody heard of. Okay, because we don't know anything. Okay, during the acute infection of COVID-19. But until today, we are quite confident how to manage COVID patients. We're quite confident what to do during this infection. But once they have recovered the so-called long COVID syndrome, okay, this is still an alien to us, okay, because when we do a lot of study, most of the study that we do was into the the patient that had been hospitalized, those patients that were very ill from COVID. But if you look into literature, patients that suffer from the so-called long COVID syndrome are those who are never needing hospital admission. Those patients that are relatively quite well, okay, so they don't require hospital admission. They have recovered from COVID at home, but after that, they still suffer from, they still don't feel well. They still don't feel like themselves before they get COVID. So this is what we call the long COVID syndrome. But because they are quite well, they've never been hospitalized, nobody really care about them in a sense. Okay? Nobody really know what's happening actually in their blood, what's actually happening in the brain, what's actually happening in the lungs. Okay, so unfortunately, the entity of long COVID syndrome is something that pretty much no man's territory lah. Unlike what happened during the first time you get COVID. Okay, we know how to diagnose, we know how to treat, we have papers and literatures, evidences, what treatments work against others. But what happened after they have recovered, nobody really knows. Okay, we have described, yes, we have described those with prolonged cough, we have described those with prolonged brain fog, those who could not think properly, we have described those with anxiety and depression, but nobody really knows what caused the prolonged COVID syndrome, what caused the long hauler syndrome, some people call it, what caused the post-acute COVID syndrome, some people call this. So in other words, nobody, I would say nobody really is an expert in the long COVID syndrome, okay? Because it's still a pretty much a gray area with regards to COVID itself, okay? You have to understand we have been dealing with COVID for 2 years, okay? So this is our time to learn about what happened in those patients who survived, okay? What happened in the immunity, for example, okay? Because pretty much it's very complicated when it gets into COVID. So this slide just show you again, like we have learned about COVID. This is our 48 months, okay? For the last 2 years, we pretty much well versed into what happened in those patients with acute COVID infection, okay? But what happened after the acute COVID infection, we still do not know much. So I pretty much like to emphasize again, so just to remind us why COVID is bad infection, why COVID is important, why vaccine is important, because in the end of the day, you don't die after you have recovered from COVID. You don't die in the long COVID phase, okay? But you die during the acute COVID infection, especially those without vaccine. So again, no matter how much emphasis you want to talk about the long COVID syndrome, the awareness should be in the acute phase because the complication happened during this phase, okay? The death happened during this phase. So we're pretty much sure about what happened during the acute COVID infection or what we call the short COVID syndrome lah, so as opposed to the long COVID syndrome, okay? So pretty much during the short COVID syndrome, you can divide the illness into 5 phases, okay? 1, 2, 3, 4, and 5. And although this may not necessarily be true, okay, but the 5 phases can be divided into weeks, okay? 1 week, 2nd week, 3rd week, 4th week, 5th week, especially with the Delta variant, okay? During the first phase or the incubation phase where you get COVID from somebody else, okay, assuming this is the worst case scenario where you did not get any vaccine, where there was no vaccine, because when the vaccine is in, the complication is a little bit different. The story is a little bit different. This is a typical case where you get COVID infection without vaccine, okay? So assuming the worst case scenario, you get the Delta variant. Okay, so the Delta variant, unlike other variant, makes you ill faster. Okay, so unlike 14 days in the original Wuhan COVID virus or the Alpha variant in the UK, so the Delta variant just take about 5 to 7 days, okay, to replicate in your body. Incubation means the virus gets to you, but you don't feel ill. You don't get unwell. So basically, you don't even know there's a COVID inside you. Okay, so you incubate slowly. Yeah, you baking cake, right? So incubate slowly up to 7 days. After the end of the 7 days, your body give up. Okay, basically the virus just get too much in your body that your body cannot contain. Okay, that's when you fall ill. Okay, that's when you start to have fever. That's when you start to have muscle pain or myalgia. Okay, that's when you started to have dry cough. Okay, that's when you start to feel tired. This is the second phase where we call the viremia phase. The viremia phase simply means that the SARS-CoV-2 just replicate in your throat, for example, and become too much for your body to contain. Okay, you wouldn't get breathless at this point. You wouldn't get low oxygen at this point because during the viremia, the lungs are pretty much healthy. Okay, there's not much damage in the lungs yet. So people don't die during this first 7 days of illness. Okay, so you must understand between the illness and the incubation. Okay, so the first 7 days of illness is quite important because most people, they calculate their COVID days from the PCR day. That's not correct. Okay, that's not correct to calculate your day of illness from the first PCR day lah. So you always calculate the first day of illness from the first day that you become unwell. Okay, that's very important because the day of illness will predict the rest of the story. Okay, so say that you come to us with 3 days of fever. Okay, so we will say that you have COVID-19, day 3 of illness. So day 3 of illness will still fall within the 7 days of viremia phase, where we don't anticipate that you get bad COVID just yet. Okay, so the day of illness is important. So always be sensitive to your own body. Okay, if you PCR is positive today, okay, so always go back to the first 3 or 4 days prior to why you did the PCR. Okay, because if you remember you have been unwell or get a muscle pain or muscle weakness on Monday, okay, that would be your first day of illness. So by telling that to your doctors, okay, so it will change a lot of things. The management will be so much easy when we know the day of illness. Okay, after the first 7 days of viremia, okay, this is when trouble happen. This is when people die. This is when you hear people need to put to sleep, people need machines to breathe. Okay, this is what we call the third phase or the CRS phase. CRS stands for cytokine release syndrome. So basically, in somebody who has not been vaccinated, our body gets so excited, so teruja lah in bahasa Melayu, so excited with the SARS-CoV-2, with the virus, because we never had this virus in our body. Okay, so our body is like so excited, so new. Okay, this virus is so new to us. So instead of one virus, we produce one antibody. Okay, so 1 fight 1 equal to 0. CRS simply means that you have one virus, but you produce 100 antibodies. So definitely the virus will die. Okay, but the 99, the antibodies has nothing to do, got nothing else to do. So in the end of the day, they are the one that damage your lungs. So looking at this, it's not actually the COVID that kill you. The virus, in the end of the day, never kills you. Okay, so your own body actually kills you because you die when your body is so hyper excited with the antibodies. Okay, the virus has so long gone. Okay, but the rest of the antibodies got nothing else to do. They are the one that causing the storm and damage. They are the one that makes you breathless. Okay, that leads to the other complication. Okay, CRS kills you. Some people don't get into the other two complications. ARDS means after your cytokine, after your antibody flooded your lungs respond to this antibody by making it more wet. Okay, making it secreting more cells or more inflammatory cells to combat the so-called antibody. So this makes your lung more distressed. Okay, acute respiratory distress syndrome stands for ARDS. Okay, this simply make you more breathless than you already been. Okay, so this is important because in ARDS, we don't have any specific medicine to give, okay? You don't give ivermectin, you don't take any other special medicine. You just need a proper ventilation. You just need a proper oxygen device to expel all the fluids from the lungs out, okay? So there's no special medicine to this. As opposed to the final stage. This is the final and the final complication of COVID. We call it organizing pneumonia or OP. It happens during the fifth week of disease lah. I mean, the final stage, the fifth stage of disease, where all the bad materials in the lung clump together, stick together, and makes your lungs become hard. Okay, this is bad. This is really bad because this area is non-functioning. Okay, they are all dead cells, dead material, dead lungs. Okay, you can never use this area to ventilate yourself. Okay, it just occupy your lungs, make it more messier. Your lungs become smaller in volume, but it has no function. So basically, organizing pneumonia just simply a dead part of your lungs, which just make you more breathless. Okay, in the end of the day, you need to repair this on your own. Okay, the healthier you are, the faster you recuperate, the faster you repair your lungs, because we can give steroids to slow the process, but to repair it is up to you. Okay, so this is why it's very important. One of the very important message here is before you get COVID, be fit. Okay, many factors will determine the good outcome in this. Okay, if you keep fit means you have a normal body mass index. We know by now obesity is the biggest risk factor to get bad COVID, because if you are obese, your lungs, especially at the very base, at the very bottom of the part of the lungs, become, I mean, is compressed by the unnecessary mass. I mean, by the body fat lah. So basically, when your lungs cannot expand properly, compressed by the unnecessary, the extra weight. Okay, that's when COVID really likes to be lah. When the area is not ventilated properly. Okay, so and that's when you breathing slower than usual. Okay, COVID like this. Okay, so before you get COVID, be fit. Okay, keep your body mass index in normal. Okay, there's no point of taking vitamin Z and vitamin D during COVID. You need all the vitamins to prepare yourself before COVID. Okay, so the main lesson here that we can see that prepare yourself. Okay, because the pandemic will not stop here. Okay, we will have another pandemic in 5 or 10 years down the line. COVID 30 lah, COVID 40 lah, we never know. Okay, so prepare yourself before we get there. All right, so this is pretty much what happened during the acute COVID infection. Okay, we're pretty much sure what happened during this period. We can anticipate, we can predict. Okay, we can give you the proper medicine, we can ask you to do the proper maneuver. Okay, so pretty much during the last 48 months, okay, during the last 2 years, infectious diseases doctor in Malaysia have pretty much have a confidence to treat and to approach acute COVID infection. But what happened after that is something else mystery. The long COVID is something mystery. So this is basically a CT scan. Okay, a CT scan basically, as opposed to X-ray, a CT scan will show your scan from your chin to your waist. Okay, this is a level of the heart. Okay, so this is your lung. Okay, black is good, white is not good. Okay, this is your chest, this is your back. All right. This is important to show because we don't see this kind of infection in other virus. Okay, only SARS-CoV-2, only COVID-19 caused this kind of lung problems. Okay, as I said, black is normal. Okay, you can see that the front part of your lungs are nice. Okay, black is nice. Black is full of oxygen, but the white stuff are all COVID material. Okay, this is worse. The right lung is bad than the left lung. It's worse than the left lung. The left lung, you can see even the back part is still, still have white opacities over there. Okay, it means that COVID already involved. Only in COVID we can see that they like the back part of the lung, okay, the bottommost part of the lungs, okay, because if you remember, one of the first discovery in COVID is SARS-CoV-2, the virus only can get into your cell if you have the ACE2 receptor, okay. This ACE2 receptor is everywhere, is in the cells everywhere, but they are most abundant, they're a lot more in the back part of the lung, especially in the bottommost part of the lung. So that's why COVID-19 affected first mostly worse in this part area of the lung, the back part of your lungs and the bottommost of the lung. Okay, this is important because once if you have COVID, okay, okay, the slides. Once you have COVID, we always ask you to lie like the Superman. Okay, ask you to lie prone. Okay, because if you lie like the Superman, okay, the gravity will pull all the dirty materials down so that your back part of the lungs can heal faster. Okay, this is important to understand because in order to treat COVID patients, it's always involved both doctors and patient. We can give you the medicines, but as a patient, you need to heal yourself. You need to clean your lungs yourself. Okay, the longer you manage to lie prone, okay, lie prone means lie like the Superman. Okay, the faster your back part of the lung can be cleared off all the dirty materials lah. So by lining proning, okay, so that's one of the important maneuver in order to make sure that the COVID will still be pretty much under control. All right. So remember I said the phase of the acute COVID phase, okay, you have the incubation phase, viremia phase, and the cytokine release syndrome. This is important because in the end of the day, one of the theory that hypothesized what happened in the long COVID syndrome is the higher your antibody during the first phase, okay, because in the end of the day, this antibody, these cytokines, okay, your body responses to the virus, this will go to your organs, this will go to the brain, this will go to the lungs, this will go to the heart. Okay, this will affect one of the theory why we think long COVID syndrome happens. Okay, because we postulate that the more antibody you have, okay, the more immature antibody you have that settles in the organs, okay, the brain, the heart, the lungs, okay, the more symptoms that you will perceive after you have recovered. Okay, so this part is important, but I would like to highlight that this is different if you have been vaccinated. Okay, if you have been vaccinated, okay, once COVID gets into you, your vaccine will work. Okay, your vaccine will start to produce antibody. Okay, so if you can imagine, you would develop a proper antibody reaction during the first week of illness as opposed to if you have not been vaccinated. Because if you have not been vaccinated, your body will just started to recognize, hey, there is a new guy in our body, there is a COVID-19 in our body, what do we need to do? They will just start to have their meeting, okay, during this period. As suppose if you have to be vaccinated, the vaccine will already introduce you the blueprint, okay, to how to produce the antibody. Once you have the COVID-19 in your body, so the blueprint will start to produce the antibody. So your body already recognize in advance of this so-called SARS-CoV-2, okay? So as opposed to being vaccinated, once you have been vaccinated, completely vaccinated, okay, once you get the SARS-CoV-2 breakthrough infection, okay, one thing we need to understand, vaccine does not promise you not to get COVID. What vaccine does promise you is not to get bad COVID. Okay, so in the end of the day, breakthrough infection happen. Breakthrough infection means once you have completed the vaccine, yet you still end up with COVID. Okay, so once breakthrough infection happens, you already have the antibody during the first week of illness. Okay, so you can imagine instead of the virus becoming more, okay, the antibody will make sure that the virus becoming less. Okay, So this is important in two aspects. Number one, you become less ill, okay, because the virus number is coming down instead of coming up, because the antibody already killing the virus. That's what we want. But other important aspect is you become less contagious, as opposed to you have not been vaccinated. You produce more virus in the first week of illness because your body just started to learn, just started to produce antibody. You're passing the virus to others. Okay, it's not just you fall ill, but you make other people more ill. Okay, by giving the virus to others. That's why vaccine is super important. Vaccine is really the key player in COVID-19 lah, must tell you. So while with vaccines, two things happen. You become less unwell and you become less infectious to others. All right. So this is important when you are in the first 7 days of being ill. But more importantly, you already have the nice antibody numbers. Your body already not become so hyper excited. So you have one COVID, you produce 1 or 2 antibody. So you don't have the so-called storm. All right. So in the end of the day, your lungs are not flooded. Okay, so for the last 3 months, we haven't used fancy medicine to treat COVID. For the last 3 months, we haven't used very high and fancy oxygen delivery method. Okay, so the last 3 months really something that we really appreciate when it comes into COVID infection. As opposed to March, April, and June, where COVID was really bad, okay, people die every day, all right? So the last 3 months, we have seen a lot of good things lah, when the vaccine really kicks in, okay? So that's the most important lesson. And if you've been vaccinated, you have a proper antibody control, okay? So the long COVID syndrome should not happen as opposed to those vaccine naive patients, okay? Because one of the postulation is the more antibody you produce, the bad antibodies, okay, the cytokine, right? So the more long COVID syndromes you would perceive, okay? So this is true actually, because we see less problems, less complication, less complaint from those who have received vaccines, okay? But when we follow them up, okay, those as opposed to those who have not been vaccinated, they still complaints of cough, they still complain of being difficult to concentrate as opposed to those who have been vaccinated. So again, in the end of the day, be it a short COVID syndrome, be it a long COVID syndrome, vaccine really makes a difference. Okay, so again, I cannot emphasize the importance of vaccine. Okay, vaccine in COVID-19 makes a difference. All right. Again, this diagram just to summarize what happened in short COVID syndrome. Okay, we go from up to down. In the viral phase, okay, the COVID just replicate in your throat. Okay, one of the proven antiviral that we can give is remdesivir. Okay, this has been proven to make people get better faster. Not ivermectin, okay, and nothing else, okay. So ivermectin has been proven to be not helping at all in COVID-19, okay. Unfortunately, if your disease progress, okay, so when COVID and the antibody reaction gets and complicate the lungs, we have few medicine to give, okay. So we are pretty much sure what to do during the acute COVID phase, all right. So unlike in what happened in the long COVID syndrome, okay? So a lot of question mark there, because in the end of the day, nobody really can put their foot down and say, hey, this is what actually happened in the long COVID syndrome. Because once you can identify the root cause, okay, like in what happened in the short COVID syndrome, okay, you can identify the virus replicate, so you give the antivirus to kill. That makes sense. You identify that one patient becomes difficult to breathe once the oxygen become low, okay, that is because of the immune system rather than viral itself. So you theoretically you give medicines to bring down the immune system, steroids, the JAK inhibitor, baricitinib, tofacitinib, tocilizumab, are those fancy expensive medicines that has been proven to bring down the immune system, to make them less hyper excited. But nobody knows actually what happened in a long COVID syndrome, because there's no treatment just yet. Okay, number one, we don't study long COVID syndrome much because most of the patients are category 1 and 2 patient, and yet after 10 days, after 14 days of COVID, when they have been declared recovered, they still have some cough, they still feel tired or fatigue or lethargy. Okay, they still have some complaint of shortness of breath. Most commonly described is what happened in the brain. Okay, cognitive impairment means they can't make a good decision. Okay, most of us before COVID also make bad decisions, a joke aside. Okay, but after COVID they still have difficulty to make decision, brain fogging, what we say. This is quite common in any viral. Okay, after dengue you still feel a bit foggy. Okay, you still feel a little bit less decisive. Okay, that's what happened in viral infection. Most importantly, the psychiatric, the psychological aspect, they're still anxious, they're still depressed, but we don't think this is pretty much happened during the acute infection when where they don't know what's actually happening. Okay, rarely, very rarely, okay, you still can get blood clots after you have recovered from COVID. Then the blood clots can really block your heart and cause heart attack. But this is very rare. We rarely see this. But most commonly, we see what happened in the lungs and what happened in the brain. But nobody really knows what happened because there's no more virus in there. Okay, so you should not kill it. There's no more excitability of antibody. So you should not give the fancy medicine. Nobody really knows. Okay, so what we know in the long COVID syndrome is they don't die from these two aspects. They don't die from cough. They don't die because of anxiety. They don't die because of depression. But not dying doesn't mean good. Okay, because these symptoms are annoying. Okay, sometimes getting annoyed is worse than die, I would say. Okay, so they get depressed, they get anxious, they can't sit still. Okay, so this make their life miserable. Okay, so in the end of the day, long COVID syndrome is an important entity because they cannot function like themselves before COVID. Okay, but one thing that we can say for sure, no matter how bad your COVID is, it is reversible. Okay, no matter how bad your acute COVID is, no matter how bad your lung gets, 100% lungs gone. Okay, they all gets better. Those who survive, that gets better. The damage is reversible. Okay, nothing is permanent when it comes into COVID. So when it comes into long COVID, it's just a matter of how long. Okay, in the end of the day, the anxiety and depression should get away when they understand what they're going through. Okay, so this is important when it comes into doctors and patient relation. Doctors really need to sit down and tell them what are they going through, so that when they understand, they can own their problem, their disease. Okay, that's when it's very important. Okay, that's when the anxiety and depression can settle. Okay, so I will talk about what happened in the long COVID syndrome when it comes into the lungs. So in the end of the day, we know that ACE2 receptors are more abundant in lungs. So that's why COVID-19 attacked the lungs. So it's very common if patients keep complaining after they have recovered the long COVID syndrome. When it comes into respiratory complaint, they will complain of having cough, permanent, persistent cough. Some of them really will complain of having perceived shortness of breath, and some of them having just a mild chest discomfort. Okay, they don't still feel right when they breathe in. This is very common, especially when the lung is bad. Okay, when they gone into category 3 and 4, when some degree of your lungs, some degree of your lung got affected, they are bound to be coughing when they go home. Okay, even they have no longer deemed non-infectious. When part of the lungs, for example, 50% of the lung get organizing pneumonia, they can go home, but they're bound to feel breathless when they exert themselves. Okay, this is understandable. This is all physiological response to the disease. Okay, they're no longer infectious, but they're still not 100% just themselves because the lung itself need time to repair. Okay, so this is part of the long COVID syndrome. How fast they repair themselves, it's up to them. One COVID patient is not the same as another COVID patient. That's why I say the fitter you are, okay, the better you prepare yourself, touch wood, if you get COVID, you can recuperate faster. Okay, you can repair your lung faster. The faster you repair your lungs, okay, the faster you are out from the long COVID syndrome. Okay. So just to share that at this point, everybody who involved in COVID care, okay, the staff nurses and on the COVID ward can understand COVID pretty much. Basically, COVID just affect your lungs. Rarely we see COVID affect other organs, but yes, we do see, okay? But predominantly COVID affects the lungs. So there's no question, the people don't ask actually once they are discharged, why they still suffer from these complaints, because the lungs will take time to heal. Okay, that's one thing for sure. So the important message that you need to ask your patient is how much your lung got affected. The more lungs tissue get affected, the longer you take to recover to become yourself like before COVID. All right. So this series of X-rays just show you how bad COVID can be. Okay, this is actual X-ray from actual patient. This is a normal chest X-ray. Okay, when they come, nothing bad in the lung. Okay, this is your heart. Okay, it's not normal not to have there, right? So you need to have your heart. Your normal lung should look black. Okay, so this shows how COVID affect the lungs from the X-ray. So you can see that there's white patches there on the X-ray. All right, and as the COVID get worse, more white are seen. Okay, so this is when they get really breathless. All right, so this is a CT scan. A CT scan is better than a chest X-ray when it comes into how much COVID affects the lung. So you can see that almost 80% of this part of the lung got affected by COVID. All right, only this part are normal. The black part are normal. The rest are COVID. But like I said, in the end of the day, no matter how bad your COVID is, you survive your COVID, okay, within a month, okay, February until March, this patient, he has recovered, okay. The lung has repaired himself. He has repaired himself. So all the white things are gone, okay, so replaced by more or healthy lung tissue. So in the end of the day, you will have recovered. But for example, say that this patient is discharged in February, okay. But of course, from February until March, he's not infectious, but he still will suffer from the prolonged COVID syndrome. Okay, this patient still complain of cough. This patient still complain of having shortness of breath. But that is understandable. Okay, you take time for your lungs to repair itself. Okay, so until then, you will still be coughing. You will still experience some degree of shortness of breath. Okay, but this long COVID syndrome is understandable. There's no special medicine to give. Reassurance, we explain to them. Okay, once they heal, once they get better, the more intensive they do the lung rehab, the faster they will recover. Okay, this is just another clearer X-ray just to show how COVID can progress very fast. Okay, during the short COVID period. Okay, so this patient comes in the viremia phase. Like we said, when it comes to viremia, your lung can still be normal. Okay, but once they get into the CRS phase, the antibody will just flood the lungs, okay, the bad antibody, right, the cytokines. And then if the disease is not under control, it will progress and become so bad. Okay, you can appreciate that most of the lungs are full of dirty materials and interaction between your body and the COVID. So that's when you really get breathless and you really need to get help, all right? This is our actually patient, okay? I mean, this is important why we ask them to lie prone, okay? By lying prone means the chest is on the bed, okay? So that the back part of the lungs can heal faster. Some of them progress to ARDS and organizing pneumonia where we need more than that, okay? This is high flow nasal cannula. We haven't used high flow nasal cannula in the last 3 months, just to say that the vaccine really works. But this is all the patient that we saw before vaccines really out and about. So once they get into the next phase, when the lungs get so flooded with dirty materials, they cannot breathe easily, they get tired just to breathe in, they get tired, okay? So they need to be put on machine, okay? That's when we say category 5, that's when they need to be assisted by machine, okay? Most of the time, we don't want that to happen. This is tocilizumab. Okay, it need to be covered, especially because this tocilizumab is very expensive. Okay, about 8,000 ringgit per course. All right. So you need a special medicine just to bring down the immune system. Okay, so with vaccines, we rarely use tocilizumab. I hardly prescribe tocilizumab in the last 3 months. Okay, so vaccine cheap and works. Okay, vaccine prevents your body from get hyperexcited. The vaccine teach you to produce a proper amount of antibodies. Okay, so that you don't need the fancy expensive medicine. Okay, you don't need to go the unnecessary and tragic. It's very traumatic. Okay, most of my patients who survive, they're really scared when they get.
Sorry, doctor, I think if Wi-Fi is still on bit of a problem, we can't hear you.
Yes, we cannot hear you. Nasmi, can you help doctor, please?
Doctors, you still there? Wait, I try to reach doctor.
Okay, thank you.
Okay, while waiting, if there any question, you can post into the Q&A box. Yeah.
While waiting for the doctor, if you have any questions, just feel free to ask in Q&A. Yeah, and then we will compile everything and doctor will answer one by one the questions. I think Carol, you can assist also from your end for doctor presentations. Yeah, thank you.
Trimeta, we won't be able to assist from this end because we are not sure which slide he would require. So unless you can tell us which slide, it's going to be difficult. So I think we'll wait for the doctor to come on so that he can complete his presentation.
Wait a moment, it
Okay,
was-
doctor try to connect again. Suddenly disconnected his laptop.
Yeah, no problem, Nazmi. We'll wait for him to connect rather than sharing screen with his presentation, which we have no idea which area to go to. Nazmi, while waiting for the doctor, maybe you can play the video.
Okay, can.
Thank you. I see we have Dr. Yazli back. Welcome back, doctor.
Hey, I'm sorry, it suddenly got cut off from the Wi-Fi.
Well, that's the problems with modern technology. It doesn't work just like everything else. Well,
Yes,
good to have
like
you back.
COVID.
Please continue.
Yeah. Can you hear me quite clearly?
Yes, very clear.
All right. Okay, good. So I'll continue my.
You still have to share screen, doctor.
Correct. I'm sharing now. Can you hear? Can you see the screen?
Not yet. Okay, now we are on.
All right. So
Go ahead, please.
Okay. Apologize for the interruption. Like Mr. Ramesh said, like long COVID, this present.
Yes, you go. The Wi-Fi has got long COVID.
For us to understand what happened, the reap we can share, the more we can understand what as consequence. So as opposed to OP,
Sorry, doctor, you're not coming through as yet. I think the Wi-Fi is still acting up.
I think we lost him again.
Nasmi,
Yes, it looks
I
like it.
think you can open his slide from your end. It was number 4, I think, from the last. So doctor just presenting immediately.
Can you hear me now?
Thank you.
There you are, doctor. You're back.
Maybe,
All right. Sorry.
maybe
So
I can share the slide.
Yeah,
okay.
So
Nasmi, you can share the slide. Yeah.
All right. Am I sharing
Yes.
slides or what?
Yes, you're clear now, doctor.
Okay, clear, huh?
number slide.
Next.
Next. All right, next. All right. So yes, next slide. So after the lungs complication, you can see that brain is the most affected, the second most complaint that we hear. Okay, by brain I mean patient complain of difficulty to think clearly, difficulty to enjoy themselves like before COVID. They become anxious, they become depressed. Okay, this is, I mean, even without COVID, you can appreciate that in the COVID ward itself, you're not allowed to be seen by your relatives. Okay, you're not allowed to be visited by your loved ones. Okay, I'm not talking about those with good COVID. Just imagine those with bad COVID. Okay, in the end of the day, they die. Okay, but they die without a proper closure. Okay, no family can see them. Okay, just imagine how heartbreaking literally it can be, not just to patient but to the rest of the family members without COVID. So even without a direct consequence of COVID infection, those family members who lost their loved one due to COVID suffer in a certain ways. Okay, not to mention what happened to those who survive. Even those who survive, they don't still feel like themselves. Okay, depression and anxiety is very common. So it's very important for doctors to sit down again and again and explain to patient what actually happened during the COVID phase. All right, next slide. Okay, actually there are 2 more slides, but I will just, maybe it's a bit difficult to share now, but I'll try. Can you see the slides?
Not yet.
Sing?
Not yet, doctor.
Maybe tak ada kot. Cannot Can you see the slide?
Yeah, we can see it now.
Yes.
Okay, so I just would like to share this interesting case. So he allows me to use his face. This guy, he came with viremia with COVID, but he came with very rare presentation, a stroke. Okay, you can see that his right eye is not as normal as his left eye. This is what you call a facial palsy lah. But it's more than that. He had nerve infection by COVID. Okay, so in the end of the day, he suffered from the cytokine storm. He became breathless. He need oxygen, but he came with a very weird, like brain presentation lah, very rare. This is an actual CT scan, very bad COVID. Okay, but in the end of the day, he recovered. Okay, one of the key points to see your patient have recovered is they will order foods that different lah. If they don't want to eat your hospital food, they will start to grab their phone and order from Grab lah. Like this case, you order MACD. Okay, but that is one important features of recovery. They will start to order food that they like. All right. So what I'm trying to say is COVID again can affect other part of your body, not just lungs. It can affect the brain. This is not a vaccine case. Okay, so this is before the vaccine is out there. But even with a very bad brain complication, lung complication, when we saw him in the clinic, he's fine, he's well. He did not suffer from the long COVID syndrome brain-wise. Okay, he could think he's back to work now. He was not depressed, he was not anxious. Okay, it's important during this phase that you really explain to them what happens. You really explain to the family members what happened. At least when they go back, the support is there. All right. That in the end ends my presentation. Any question is much appreciated.
Okay. Thank you, Doctor, for the presentations. It was very insightful, actually, for all of us. Yeah. So we have some questions here.
All right.
Okay, there is another one. Like, I heard there are antiviral discovered. Is antiviral? Is it really works? Antiviral.
Antiviral. Okay. So we have many antivirals. Okay. Last year we have hydroxychloroquine. Okay, the malaria treatment. We have the Kaletra, the HIV treatment. We have the azithromycin, the bacterial pneumonia treatment. This year we have ivermectin, okay, the worms for cows and goats, the animals treatment. But those are proven not to be effective antiviral. Antiviral means you take it, the viral dies. Okay, the viral dies straight away. All right, you don't need the antibody to do it. At this point, remdesivir is one of the proven antiviral that works to kill the virus, even favipiravir, Avigan, that we've been using so much in the last couple of quarter last year. So not proven to be effective to kill the virus. So at this point, yes, the faster you kill the virus, the better you should be. Okay, so remdesivir has been proven to be one effective antiviral that can be used to treat COVID-19 patients, but not the rest, not yet.
Okay, thank you so much. There is another question, Salam from Susana from Innovic here. Many attention is given to vaccination and swab test. How about prevention and correction methods? KKM impose disinfectant using, KKM impose disinfectant using alcohol base, but many do not apply due to time and cost. But is it effective?
So, number one, we never heard of people getting COVID from touching doors or touching floors or from touching the desk. Okay, so you get COVID from people. Okay, as long as there are 2 persons there, COVID will be there. Okay, unless you are the only 1 person in your whole country, then your country is free from COVID. All right. So you need human being to pass COVID to others. Okay, not desks, not floors, not curtains, not beds, not any materials. Because COVID, yes, say that you have COVID, you cough. COVID can be briefly in the air and then it will fall down. Okay, because the structure of COVID itself is too heavy for it to be airborne. By airborne means I cough here in Sungai Buloh, COVID from Sungai Buloh will be there in Ampang. Okay, so it's not like that. If it's that the case, we will never hear the end of COVID. So COVID is not strictly airborne, right? So we only advise you to disinfect surfaces where a lot of people touch it. Okay, high touch area. Okay, high touch surface area like escalator materials. Okay, when you go to shopping mall, okay, don't try to touch the escalator rubber because most people touch it. Okay, so not try to touch it. Not to say COVID is there, but say that a COVID person just coughed. The virus can remain on the object for few hours, depends on the surrounding. A few minutes, few hours, nobody really knows exactly how long they can survive, but in the end of the day, they will die on non-human material. So, but if you think that the area has been touched by many persons that you don't know the background, so yes, you need to disinfect the area. But if you live in a house, you don't need to disinfect your house now, because in the end of the day, no COVID can survive on the walls and whatnot. Okay, you don't need to waste money disinfecting the whole areas.
Okay, hope that answer you, Ms. Susana. So we have also another questions. My friend mother recovered and discharged from hospital after infected by COVID-19. 3 days after discharge, she is having a short of breath and passed away at the end. How we can avoid this happen?
I really want to know, number one, of course, no, I mean, this kind of question, we really need to know what happened during the hospitalization, okay? Because just after discharge is something that is not supposed to be heard of. So to comment your question medically, I really need to know what's happened during the hospitalization. Okay, but number one, we try not to discharge patient prematurely. Okay, especially with COVID. Okay, we don't discharge them prematurely. Means if they're not fit for discharge, we don't discharge. Okay, but of course, many things can happen after discharge. Of course, if we think they are well, still complication can happen at home, but rare. Okay, blood clot still can happen after your 14 days of COVID. Okay. Heart attack can still happen after the 14 days of that COVID, all right? So in the end of the day, what happened during the hospitalization will really determine of what happened consequently. So in general, no doctors will discharge patient prematurely if they think it's not safe to discharge. Okay, so I really need to know what happened during that hospitalization to answer that question, but it's not your fault as a friend. All right, so yeah.
Okay, thank you. Oh, I think there is another question here from here. So what is your advice for all people who have affected for more than one COVID-19 virus? Some people, they got twice. So what is your advice for all these the patients who had affected for twice COVID-19 or more than one?
Find a place somewhere else. Okay, I don't think wherever you stay is safe to get a COVID twice. It's very rare. Of course, once you get a true infection, we say that you are pretty much protected in the next 3 to 6 months. Your natural antibody should prevent you from getting another COVID unless the COVID in your locality mutates and becomes something else. Because if the COVID mutates and become a different variant, okay, that can evade your current immunity. So my advice to you, always be sure of the PCR result. Okay, most of us fail to interpret the PCR properly. Okay, any detected values on the PCR doesn't mean you have COVID. Okay, so you really need to have an expert in that field to say, hey, you have true COVID or a false COVID, because most of the time you have false COVID. Just because your PCR is detected doesn't mean it's true COVID. Okay, so you really need to sit down with your doctors and the doctors need to explain, because doesn't mean the CT value means a true COVID, all right? So most of the time, the first so-called COVID is not a COVID infection. Okay, it's a false COVID. All right, but you'll be liable to have COVID. Okay, so you can get another real COVID infection, which is the real one. So it's rare to have 2 consequent COVID within 3 months or 6 months. Okay, but so you really need to interpret the PCR results. Okay, if it's really the case, my advice is live somewhere else where it's a bit safer. Okay, mask, vaccines, okay, social distancing, those things are still very important.
Okay. Okay, thank you so much, Doctor. So from all the attendees here, is there any questions? Any more questions? Oh, I think there is another here from Ms. Susana. We have an award winner long-term disinfectant made in Malaysia. European compliance proven to kill COVID within 1 minute. Unfortunately, KKM is not supportive with no reasons. Can anyone in the panel support our effort to get KKM to acknowledge and support? That one, I think Ramesh will advise. I think, yes, I think for Mrs. Anna question, this one, Mr. Ramesh will advise later on. Not under our authority. I'm sorry. Yeah, we have another question from Mr. Mike. Are joint pains part of long COVID after effects? Dr. Yasli, please.
Sometimes if you have viral infection, you can have the arthritis or arthralgia. Okay, but in general, it's been reported that arthralgias happen, but not arthritis. So you need to understand the difference between arthritis and arthralgia. By joint pain, it means arthralgia, but if your joint gets swollen and red and painful, then arthritis. So we never heard of COVID causing arthritis, okay, because there's not much of ACE receptor in the joints. But arthralgia is very common. Even during the viremia, where you have muscle pain and joint pain, that's quite common because that's how your body responds to the illness, all right? But as a long consequence of COVID, it's rare to have arthralgia per se, and most of the time arthralgia happens during the first episodes of COVID, okay? So in this kind of situation, you need to understand is because most of the time patients who had bad COVID are very high body mass index, so gout is very common. Okay, so we need to make sure that this is not gout they're complaining of. So again, joints are quite rare as a result of long COVID syndrome. So as a doctor, you really need to look into other potential explanation why they have the muscle pain, as long as it's not arthritis.
Okay, Mr. Mike, is that answer you? Or if you want to say or write more, you can also unmute your speaker and talk to doctor immediately. Yes, thanks. Okay, you're welcome. You're welcome. Next question, doctor. What is the guarantee the vaccine is really work? Now we already try to back to normal life, and some suggest to take off the mask. So, what do you think about that, please?
Okay, number one, like we said, for the last 3 months, we haven't used the fancy tocilizumab, that's massive tocilizumab. For the last 3 months, we haven't really used the high flow nasal cannula. Okay, pretty much our life as the frontliners are much better in the last 3 months. Okay, so I managed to breathe. Okay, I managed to sit down and finally talk properly. Okay, otherwise it was literally bad days. Okay, from the beginning of 2020 until August 2021, right? So it's been much better. So that's pretty much a guarantee to show how effective vaccine is, all right? But we're not supposed to take our guards down because COVID-19 is quite intelligence. Okay, they mutate to become better and stronger. Okay, you have to understand SARS and MERS are the predecessors of COVID-19. Okay, so they learn from their predecessor in SARS. Don't kill patients too fast. SARS happened, kill patient too fast. You get SARS today, you die tomorrow. So that's why you cannot spread. Okay, so they learn from that. If you want to kill the patient, kill 14 days after. Okay, so they learn from that. 10 years down the line, that's what they do. Okay, they get into us, but they don't kill us that fast. They mutate. So we don't want them to mutate and evade the vaccine. Okay, until COVID is guaranteed not to be around us. Okay, as long as you still hear COVID cases in your localities, if you go out, there are strangers around you, put on mask. Okay, if you cannot avoid social distancing, put on mask. This will prevent you from getting COVID. This will prevent you from passing COVID if you happen to be a COVID carrier. Okay, so until then, mask is super important. Before vaccine, everybody in Sungai Buloh put on mask. Very rare of us doctors get COVID. Okay, just to highlight, that is the focus point of COVID in the whole country. Okay, this is really effective than vaccine in a sense. All right, so until COVID is really disappears, mask and social distancing is quite important, as long as you are in a crowded area. Okay.
Okay, thank you, Doctor, for the explanations. We have one last question. Okay, after that we will do closing. So one more, Doctor, the question from Mr. Mike. There were comments by China doctors that the longer that the booster shot is given, the better the effectiveness. For instance, 12 months later. But now KKM is giving booster shots within a shorter period than that. What are your views on this?
One thing that we know, the immunity against COVID wanes, right? No matter how much booster you take, how many vaccines you take, in the end of the day, your immunity wanes. By wanes, I mean the numbers of your immune become lesser and lesser. But again, I must highlight, when it comes into how your immune responds to COVID-19, it's still something new, something that most of us still don't know. Okay? We learn about infection in 1 year. We're just going to learn about how your body responds to vaccine this time. Okay, this is time where we learn. We are still learning. Okay, one thing we know, COVID kills you. Okay, one thing we know, immunity wanes. So that's why we give booster, because we know the vaccines don't kill you. The vaccine will make your immunity more robust. Okay, so that's why KKM. So the Chinese claim the longer you take the vaccine, the better. Yes, that makes sense, because the more you expose yourself, the more you let your body, your own body react to produce antibody, that makes it more mature. So that theoretically makes sense. But as a policy maker, I'm not going to intervene, all right? Because we know vaccines don't harm you. Okay, so even if you get the booster earlier, it will not harm you, but theoretically it will make your immune system better than without a booster. Faster or longer the duration is a different question, but it is better than before a booster. So I'm not surprised if the policymaker decides to do that, to opt for that. Okay, because in the end of the day, they want the best from the COVID-19, the outcome of COVID-19. So yeah, the more important thing is to get a vaccine. A booster, longer or shorter period, is a different question of time. You may hear I'm saying next month that booster 1 month after the second dose is better, because we're still learning, right?
Okay, yeah, that's true actually. Thank you so much, Doctor. I think we should close soon our session today. Okay, I would like to say gratitude on behalf of KPJ Healthcare Berhad. I'm Trima Telesa Putri. Thank you so much to our doctor for your time and for your insightful presentation, your sharing knowledge to us. Thank you so much, Dr. Yasli. Also, I would like to say also thank you to Mr. Rames from Malaysia, Australian Business Council. Also to Ms. Carol. Also to our operational manager, Mr. Omar from KPJ Ampang Putri Specialist Hospital. To my team also, Mr. Nasmi and Miss Chris. So we should close soon. If if you still have any questions or anything related, either related to COVID-19 or anything maybe about other disease, you can feel free to come to our hospitals or contact me immediately to my email, trimeta@kpjhealth.com.my. Okay, I think that's it from all of us. Thank you so much. Yeah. Mr. Omar, do you want to say something on behalf of KPJ Pamputri?
Yeah, on behalf of KPJ Pamputri, we would like to record an appreciation to Dr. Yazli and those who participating this session this afternoon. Very insightful, Doctor. Thank you very much. We hardly got this kind of session. In fact, walaupun kerja dalam satu hospital kan. Okay, hopefully we can have another session lah with different parties. Okay, thank you very much.
Yeah.
All
Okay.
right. Thank you, everyone. Dr. Yazli, Cheoma, and the KPJ team. We will end this webinar session here. And as you've been told, if you do have a problem, seek out KPJ. Thank you all. Have a wonderful day ahead. Bye-bye.
Okay, bye.